So given all your experiences over the last 30 plus years in managing pain, like what advice would you have for other patients in trying to manage their pain or in navigating some of the barriers to the treatment of pain?
Yeah, I mean, for me, I do a lot of this actually because I see people who are, friends in pain, and I just feel compelled to try to share some of my experiences with them to help them. And I think one thing is to don't lose hope. I think for me, there were times in this disease journey where I've lost hope, and it felt like there was, what would I going to do next? And that would, and then ultimately I would, my doctor, I'd get together with my doctor and we would talk and, about what was next and what treatment options would be available. And, we worked through it and get the disease back under control. So I would say, use your healthcare providers and, take their advice. For me, there's many different things I tried. Massage therapy worked for me for a while. Acupuncture, I was waiting for hip replacements, and pain medication just did not help for my sleep. And I was in horrible, horrible pain. And I went to acupuncture, and this is the traditional acupuncture. And after about 3 treatments, I mean, I was able to sleep through the night. So, acupuncture, physiotherapy, I remember being in so much pain in my lower back and not understanding, thinking it. And that's the thing, you think, is it the disease? Is it something different, or what's going on? And so I went to see physiotherapists, and it turned out that I needed to strengthen my core muscles. And so she gave me exercises, and within a month, the pain was resolved, and so she helped me tremendously. My family doctor is very, very supportive. I just recently went in to talk about, can we cut down on some of my pain meds because I've been stable for quite some time, and it's a scary thing to talk about that because you don't, when you've lived such a horrible pain, you don't want to even risk having some of that taken away. So for me, working with him on trying to reduce some of the opioids now, and that's also for if it does sometime in the future flare up again, that the drugs will work better because I will be on a lower dose now, and I will be able to increase it knowing that I was on that dose before and did well on it. So I think that there's a whole, it's not just one solution. Try to do things that are fun every day. If you enjoy walking or you enjoy swimming or you try to stay active and do fun things. Also, don't be afraid to take a day off and rest and, read a book for the day. If it's, like a rainy day for me is, oh, good, it's a rainy day. I can sit with my book and relax or watch a good movie. And no, don't feel guilty. I think we tend to feel guilty and beat up on ourselves if we aren't productive every single day of our life. And I think that, with pain, we need to learn to respect it and to, work with our bodies and listen to our bodies.